For this injection, the following armamentarium will be needed: a yellow cassette with a mouth mirror and cotton pliers, a needle capper, a syringe, 2x2 cotton gauze, 27 gauge short selection, a cartridge with solution appropriate for the patient with or without epinephrine, 20% benzocaine topical anesthetic, and Q-tips. Before administering this block, the cartridge must be loaded with the top portion in first. Be sure that the barcode is pointed away from the large window and the clinician is able to clearly read the information printed on the cartridge through the large window. Provide one strong twist of the syringe so that the harpoon is engaged, and never pop the harpoon with the palm of your hand. Check that the harpoon is engaged by carefully pulling back slightly on the thumb ring. Carefully twist off the bottom portion of the needle and attach it to the head of the syringe. Twist the needle into place until snug. Be aware of bevel placement for your specific injection. For the AMSA block, the nerves anesthetized are the anterior superior alveolar, the greater palatine, the nasopalatine, and the middle superior alveolar if present. The areas anesthetized are the maxillary anterior teeth, premolars, and the mesial buccal root of the maxillary first molar in one quadrant, the facial periodontium and gingiva of the anesthetized teeth to the midline, the hard palate, the palatal periodontium, and the palatal gingiva of the maxillary teeth in one quadrant. The landmarks are the maxillary premolars, the palatal gingival margin, and the median palatine raphe. At this point, apply the 20% benzocaine topical anesthetic to your insertion point. For this injection, be sure to use Q-tips or the opposite end of the mouth mirror to blanch the tissue. For this specific injection, we will be using a 27 gauge short selection and administering 1.4 to 1.8 milliliters of solution at a depth of 4 to 7 millimeters. The point of insertion for the AMSA will be at the hard palate at the apices of the maxillary premolars, midway between the palatal gingival margin and the median palatine raphe. You will be aspirating one time. For the AMSA block, you will be administering 1.4 to 1.8 milliliters of solution, which will look like this. Be sure to thoroughly rinse your patient and dispose of the needle and cartridge in their respective bins. Let your patient know where they should be expecting numbness to occur. Post-operative instructions should be provided to the patient by the clinician, such as, while numb, please be careful not to bite your lip, cheek, or tongue. No hot temperature food or beverages, no crunchy foods. Please stick to a soft food diet until the numbness wears off.